Long time no see. There was a crow, like I thought it was just nesting in my yard. Well, I thought it was hurt actually. So I spent a little time bird watching this morning. Oh, I forgot this is being recorded already. I'm done. I'm done.
Good morning, everyone.
Good morning.
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 Hi, everybody. So for folks who are not board members and not staff of the DD board, if you wouldn't mind introducing yourself in the chat with agency affiliation, that's very helpful to us later for accurate minutes. Thank you.
Good morning.
Lynn, I think you're talking, but you're muted.
Oops, sorry about that. Sorry. It is possible, we know that there's one DD board member who will not be able to attend this morning's meeting, and there might be two. So we need 3 for a quorum. So I'm like at the edge of my seat. Hopeful for a quorum.
Lynn, what do we have? Just one board member right now?
We have two. Georgina Schuster is also here. Yeah.
Okay, I'm not seeing her. Why am I not
She
seeing
is signed in under NAMI Family Support Group.
her? Okay, there she is. All
Hi, Ms.
right.
Schuster.
Hello. I had trouble getting on, sorry.
Sorry, it's also, it's a little bit of a wait. Here comes Ann Robbins. So we do have a quorum. I do not, I know that Deb Rush is unable to join us this morning. It's possible that Sue Suter will also not be joining us this morning, but we will have a quorum as soon as Ann is connected to audio. And I want to thank everybody for signing into the chat. That's very helpful to us later and even now. Okay. Hello, Dr. Robin. And now that we have a good number of people here, I'm going to put into the chat, I'm going to put a link to the full board packet, just in case that's convenient for folks. And I'll try to show it as we go through the meeting too.
Lynn, sorry, Lynn, it's Kim. I have a question before we start. So I wanted to bring up talk a little bit about the new ARPA rules that were like finalized on January 6th from the U.S. Department of Treasury. And so I know it's not on the agenda. Is there a place for me to just kind of bring up the idea? Or
maybe at board announcements?
board announcements. Okay, that's what I was thinking. Okay.
Yeah. So yeah, that'd be actually, we could have a big conversation about that. I made a request for ARPA funds about a year ago, maybe it was March, which did not become part of what the county board approved, but it, potentially we could bring it up again. Dr. Robin is calling me. Dr. Robin, do you want to talk into the meeting and see if we can hear you now? All right, we're trying alternative means of getting Dr. Robbins' audio. So thank you for your patience, everyone. Okay,
Okay, am I in?
you are.
Oh, that's ridiculous. I'm not really sure what the problem is. And I have a lovely echo.
So I muted your other. You're in the meeting twice, but if we mute the other one, maybe it helps.
Okay, now I've got an echo that's just really not going to work.
Seems like it's better when I turn my mic off.
I wonder if I should just sign out on the computer. I'm going to do that.
And that's a good idea.
Okay, I'm signed out on the computer. And can you hear me?
Yes.
Okay.
Yes.
Other people try to talk and then I can hear them. Somebody else talk.
I'm
Hi.
talking. This is Georgiana.
Okay, Georgiana, thank you. Sorry about that. I have no idea what happened because I've never had this trouble before. I've always been able to get in easily, but this is not working. I did update my computer a couple of weeks ago, and I think some things are different. So I don't know, but I couldn't get it on my iPad or my computer. I could hear you, but I couldn't get on. So, okay, are we ready to go?
Yes.
Yeah. Yes.
Okay, apologize about the delay. This is going to be a short meeting, but I'm sorry that we started late. Stephanie, can you do the roll call, please?
Deb Rush, Georgiana Schuster,
Here.
Sue Suter, Kim Wallowitz Fisher,
Here.
Ann Robin.
Here. Okay, so Sue and Deb are missing. The next item is Zoom instructions, and obviously I have totally failed that. So let's move on to approving the agenda. And there is going to be a change in the agenda because Sue and Deb are not here. There are a couple of things that we will not do. Well, actually one that, because they're not here, we will defer item 16, the other business review of closed session minutes, until we have a quorum, not including me. The closed session has to do with something to do with Carl, and our attorney or somebody's attorney said that since I am employed by Carl, I have to recuse myself. So we are going to defer that. So that's a change in the agenda. And the other change is item 10, new business audit delays. Lynn informed me yesterday that there's no need for this because the agency that was delayed was able to get their statement in. So we can defer that. Am I correct on that, Lynn?
Yes, thank you. And that is a cause for celebration, not just because it makes the meeting shorter, but it means that our DD agencies are doing a really great job.
Okay. And they're having good luck with their auditors, because I don't think it was the agency's fault. I think it was, you know, kind of a combination of circumstances that made these things late. And that was actually explained in the packet. So I would like a motion to approve the agenda as amended with the deletion of item 10 and item 16.
I will make the motion.
Second.
Thank you. And Stephanie, I guess we need a roll call for that.
Georgiana Schuster,
Yes.
Kim Wallowik Fisher,
Yes.
Ann Robin.
Yes, thank you. Okay, is there any citizen input or public participation today? All right, hearing none, I will defer that. If anyone comes up with anything later, we'll let them in. I have very few comments today. You've already heard my apology for my difficulty with the computer. I'll have to get that sorted out next time. We do have 2 people missing today. Sue is having some personal difficulties having to do with the health of her husband. And we just want to say our hearts are with her during this difficult time. And I also want to say thank you to Sue in absentia, but publicly, for the tremendous work that she's done on the behalf of people with developmental disabilities for so long. So missing a meeting, we miss you, Sue, but thank you for all your great work. Lynn, you want to make your comments?
So I think I'm looking forward to finding out whether the CMS, the federal agency that administers the Medicaid waiver programs, did approve Illinois' wage increase. It's still not a huge wage increase, but it'll be interesting to find out over the next few months whether that's making any difference. I'm highly skeptical, but I'd love to be wrong. So it'll be that. I hope that'll be a topic in coming meetings, like where maybe we ask for some agency input on that issue. Maybe too soon to tell, but I think also I might be in a room full of skeptics. So that's one thing. The other is more close to home, and that is our application site is open. Applications for the next round of funding are due by 4:30 p.m. Friday, February 11. And there's a reason we cut it off at 4:30, and that's because I'm gonna jump in there and do some stuff as soon as I can see all the successfully completed applications. It's a moment for organizing what comes next. So we also cloned all of the applications from the current cycle into the next cycle. That's supposed to be helpful, but it might, maybe it's not. So, there might be really wonderful ideas that we just need to, the agency might just want to start all the way from the beginning to submit a brand new kind of application. So we redid our application instructions. They're very long, but we're trying to cover everything. So on the site is an updated application instructions with input from the whole team. So then the other important deadline is next Friday. The second quarter reports are due from all of the organizations that are currently funded. Second quarter reports include, in addition to the program activity reports and financial updates, there's also a CLC update, but it is Chandra Somerville has created a very simplified review that, for the second quarter report. So that's, all of that is also posted on the site. And we redid the quarterly report instructions and we included screenshots to maybe it's easier to look at. I don't know. I will be very interested for feedback from users about how well that is working. And the other news is that those reports are not due until midnight. We decided go ahead and have the whole day. It's midnight of Friday, January 28th. So those are my big pieces of news. And I just think that's really important for a lot of people on the call. So thank you for letting me take the time to address those things. That's about it.
Lynn, going back to the first thing you talked about and about CMS approving wage increases, what wage increases are under approval right now? Do you know what the wage?
This was what the state had proposed to increase for DSP wages. I think there may be others in the category with DSPs, and I don't know exactly what the wage is. The proposal was submitted a long time ago. It takes CMS a long time to approve. Kim Bowdry, do you know the details? No, okay. It's been a minute. I don't think this was a huge wage increase, like maybe $1.50 an hour. Is
That sounds right.
okay? Okay. It's, it's certainly, it's not, $15,000 a year, which would, that might keep people in those jobs. So anyway. I can send you the
Okay,
news. Yeah. I can send the details to Georgiana. Okay.
Thank you very much, Lynn, for that. Okay, we'll move on to the approval of the board minutes from December 15th.
I move
And
to,
I need a motion.
this is Kim. I move to approve the minutes.
And I will second that.
All right, is there any discussion? Hearing none, Stephanie, would you do the roll call, please?
Kim Wallowitz Fisher,
Yes.
Georgiana Schuster,
Yes.
and Robin.
Yes. All right, the next item, I believe, is the last item that we need to vote on, which is the expenditure list on pages 8 through 10. Can I hear a motion?
I have a motion to approve the expenditure
To approve
list.
the expenditure list, yeah. Okay.
And I will second that motion to approve.
All right. Is there any discussion about the expenditure list?
I had a question, and I think this is partly because I'm new and still trying to figure out all the line items, but I had a question on page 10. There was a Visa card member service charges. And I'm thinking to Menards. Am I reading that correctly? Or I guess I don't understand those items.
That's pretty much where we had to do all of the mini grant purchases. Because of, we have accounts with some stores as well, but almost all of the purchases went through the Visa card instead of directly to stores. It has to do with the county payment system. So the purchases from Menards are included in that mini grant update. This was one of the last, and it was, I don't even think it's been delivered yet. It was kind of madness. And Kim Bowden may want to explain what happened there, but yeah, this is the Visa card covers all sorts of things like renewals of our Adobe subscription, Microsoft 365, but those don't show up in your report because those are things the Mental Health Board pays for directly. This is showing up in your report because the mini grant is very specific to the DD board.
Got it. Okay, so it could have been some of the things that were purchased in the results section of the mini grant were some of these. Okay, that's helpful. Thank you.
So you won't typically see Visa charges on your expense report. So I don't think this is because you're new. It's because it's very unusual.
Okay, thank you for that clarification. Are we ready for a roll call vote to approve the expenditure list?
Yes.
Georgiana Schuster,
Okay, Stephanie?
Georgiana Schuster,
Yes.
Kim Wallowik Fisher,
Yes.
Ann Robin,
Yes. All right, well, we will, we don't do item 10, so we'll move right on to item 11, successes and other agency information. Since I can't see you on the screen, I will have difficulty recognizing people, so somebody just speak and identify yourself, and then I'll listen.
We have Mel from PACE and Greg Schroeder from DSC and Becca Obuchowski all have their hands up. Should we start with
Okay,
Mel?
Lynn, would you take over for this part since I can't see people?
I sure will. Thank you. And we'll
Thank
start
you.
with Mel.
I'll
I
just
think she
listen.
maybe got her hand up first. I'm not sure.
Thank you. Good morning, everyone. Actually, Greg started it first, but I'll go first. So I just want to share with everyone after the meeting from CCDB last month, PACE got really busy and stuff. I had someone that reached out to us for the PSW program. The consumer was in a situation that all her PSW were going out of town because of the PSW were students. And so we worked really hard and trying to find PSW for the holidays. And I'm glad to inform everybody that we assisted that consumer, and we actually found two to kind of like fill in the gap for the holidays and stuff, and then a backup and stuff. So that was a really amazing part, that two and a backup and stuff was able to accommodate that consumer for the holidays until the regular PSW come in for the coming back semester and stuff. So, and then on top of this, we had a collaboration with RPC and Illinois Respite Coalition. They have reached out to PACE and said that the main caregiver of a consumer is going out of town for the holiday. And so it's an emergency respite care and stuff. So again, we worked hard with the collaboration with those organizations and the consumer and the caregiver and stuff. And we were able to find someone at that moment for the emergency respite for the holidays for that consumer. So even though it's a temporary service, that it is an emergency with a limited funds and stuff, we were able to find a PSW on the registry that was willing to work through the holidays to assist that consumer. So those were two of our wonderful successes with the collaboration and with with a lot of the organization, and got through the holidays and stuff. So thank you.
Seems like Greg Schroeder
right.
is next then.
We all have successes. There's no rush to be first. It's fine. My name is Greg Schroeder. I'm the LEAP coordinator with DSC, and just wanted to share that over the last year, I've kind of been looking at how to expand our program. So just a little sampling right now, but hoping to share more with you in the future. We're looking at more of a public registry for employers to take the first step and take the LEAP program beyond a standalone training. So been working with Ashley, and we're almost ready to launch, but looking forward to sharing more about that at upcoming meetings.
Thank you, Greg. And next up is Becca Obuchowski.
Thank you. Hi. I just had a couple really quick things. So one, I just wanted to share that just kind of with the kind of sort of large rise in COVID cases in town, we have been offering more online options for our members, which people have been really enjoying. We've continued to do those throughout. We've had a number of, we have like a really great core group of people who have taken it upon themselves to host those meetings for other members. But we're kind of getting in there and offering a few more sort of facilitated groups too, while I think we're certainly hearing that people are a little bit more cooped up at home. So just thought I'd update you guys about that. We're hoping to be able to, offer more in-person things sort of February and beyond. But we're trying to kind of fill some of those gaps in the meantime. And then the other thing was really just kind of an update or announcement. Starting on January 1st, Community Choices, we all have new email addresses. So if you're trying to reach any of us, we're now all just like becca@communitychoicesinc.org. So just like our website. So it was a great triumph over email platforms that I learned a lot in the process. So if you're looking for any of our staff, we are all using that same format, so just first name with our then domain after it. Everybody should have their email forwarding set up too. So if you forget or haven't updated your contact, you will still get those emails certainly for the next good while. But yeah, if you're looking for us, that's where we'll be. Phone numbers are all the same. So just thought I'd let everybody know.
Hey, Becca, can you say that your email address once again?
Yeah, absolutely. It's just Becca, BECCA @communitychoicesinc.org. And I can put it in the chat too, if that would be helpful.
Okay, thank you.
Yeah.
And Annette Becker.
You're muted.
Yeah,
You're muted. You're not muted.
We still can't hear you, Annette. Oh, it says you're muted though.
I think she's toggling it on and off and it doesn't seem to be working.
Um,
Do you want to call in while somebody else takes a turn? Do you have that number? I'll send it to you in the chat.
So, Anne, Lynn, can I ask a question at this point of the agencies, or are we allowed to do that?
If Dr. Robin is okay with that, I don't think there's a procedure.
Ask away.
Okay, thank you, Anne. I had a question. So Becca, thank you so much for updating us about COVID numbers and kind of how things are going. Was wondering if any other agencies had, any communication related to that. And then the other piece I wanted to ask about is the vaccine tests and getting that for folks, entering their information online and getting those free vaccine tests, and the the N95 masks and how expensive those are. And are folks expressing that they, can't afford those masks. So I just wanted to ask if any agencies had any information related to that would be helpful for the board to know about.
I can answer some of those. I think on the COVID, as we all know, COVID is everywhere. So yeah, I mean, staff and people who attend are affected, but we have not changed our programming at this point. There are several homes that have had stays where they've been at home for certain weeks, but other than that, we haven't really changed our day program. We already have protocols in place from DHS, so there really aren't any changes to that, other than obviously if someone's exposed, they follow those rules. If they're positive, they follow the rules as well. Trying to think if there's any other, we do have some virtual options for some day program options, but the majority are still coming on site. Transportation is very limited too. I think there's basically about 4 per vehicle. So obviously they're masking at all times during that as well. And then related to masks, so we provide medical masks, surgery masks to all staff and anyone else who needs them. We do have KN95s. Typically, we're advised to only use that in a positive case situation. So if a group home had a positive case, we would use those. We have not provided all of those to everyone. I did get an email this morning on ordering a bunch of those, but yeah, I mean, they're definitely expensive. They're definitely limited too. So, and technically you're supposed to be fit tested for those too. So it's kind of so typically would only use those in a positive case situation. But yes, we are providing them in the other situations as well. What was your other question? What was the second question? I forget.
The other one was because the vaccine tests, the free ones, so not the ones you have to pay and get reimbursed by insurance if you even have insurance, but the free ones, it's an online system and you have to put your information in. And there was some conversation about the tests are only 4 per residence. So like if you have multiple, like if you have a duplex or something, it's one address. That there was, people in like the second apartment couldn't get tests. So I just wondered if if y'all are helping folks to get those free tests. And, we have 6 people in our house. So, 4 free tests are really great, but I mean, it doesn't cover 2 people. So if you're living in a place where there's 3 or 4 other roommates, I don't know. Yeah.
Yeah. I mean,
so I just wanted that information.
Yeah. That at-home over-the-counter tests have been extremely hard to get in town. I'm sure everyone knows that as well. And that has definitely hurt us being able to do a lot of that recently. We are able to do those through public health for our group homes because they're congregate settings. So typically, but they also are backed up. So we've also had delays there. But yes, we've already sent out all the information to all staff regarding signing up for that. We will absolutely help all individuals to order that if they live independently, or get all the information out to families as well. We posted it yesterday on our Facebook page. So yes, we will do that as much as we can. But my understanding is, so people who live in a, maybe a 4-bed house or a 6-bed house, they will be able to get it through this public health option. But if somebody lives in a duplex, yeah, I think if you have like an A and B, you'll still be able to get it. But
Okay.
Yeah, you're right. If you have 6 people, you're only going to get the 4 tests, unfortunately. I'm just curious as how they're going to get all these out and how long the process is going to take. I mean, I can't imagine how many have been ordered in the last 2 days. So I think it'll be a challenge for sure.
Yeah. And I guess I just meant like, just for us as, board members and, in our advocacy networks, who we can advocate that, what the labor that y'all have to do to help support that. And that maybe labor that, your consumers are experiencing, and how do we kind of advocate for that? Because I think, this sector of people maybe isn't on the forefront in some of these decisions.
I think it's all hands on deck. I think anyone who needs help will help them get it. I think honestly, the biggest thing with the Omicron surge is just we're already short staffed. And so when you have an Omicron, when you have these cases or you have exposures, you're already short staffed, and then it's just, there's nowhere to pull from. And that's really the challenge right now, for sure, especially with group homes.
Yeah, and I can just speak to the same. We also got the information about the mail order test yesterday, and I've sent that out to all staff, and people are going to be helping our participants sign up, if they haven't already, with their families. And in terms of masks, we have offered a 95 or KN95 masks to staff, and certainly when we've there's some clients who are working where when we've gone to meet with them, we'll notice like, this mask you've got is not great. And so our staff have extras that we've been offering while we've been able to get them. And so far we have, although the prices are certainly going up for those. So hopefully that doesn't get worse, I guess, because we are, it is good that we have been able to do that to this point. But yeah, that's kind of where we're at with it.
Thank you, Becca. Can I just add, that's great. Can I ask a clarifying question? Like, where would the money for, like, if somebody is a consumer of yours, where, like, who purchases a mask? So like, an N95 mask, let's say it's $20 or something. Like, where does that money come from? And people are already on a limited budget. So where does that money come from? I guess, that's what I'm kind of worried, like, how can we advocate, in our spheres about?
Well, so the KN95 masks that we've been getting, they're not the like OSHA approved ones. They're the ones that are coming out of Korea, and they cost about between 50 cents and $1 each.
Oh, okay. I was way off.
Yeah, and so they have been like tested. I mean, the ones that I've been buying, they've been tested by, third-party sources that they're bound to be, not as good as the the fit tested ones, but they are significantly better than the just like surgical mask, and certainly more so than like a cloth mask. So, we've been, using our supply budget to purchase those, from our grants and from our other funding sources. For participants, I think it really just kind of depends on their own situation, what they've chosen to purchase. I have not seen anything, and maybe if you all know, like I haven't seen anything about like where to sign up to have those masks sent to you. I've heard that is coming, or that it has recently existed. I've not seen it yet, or maybe it comes with the test kits that you order. I'm not sure.
They just announced it like maybe this morning or yesterday that it's coming. So it was on my mind. That's why. So
I've heard that too, but I have not seen anything. That would be wonderful. I mean, I think in the beginning there were a lot of masks provided to organizations, but I have not seen anything recently, but that would definitely be helpful if that does come out.
Well, thank you to both for sharing that information. It's really helpful.
Is Annette ready yet?
I think, can you hear me?
Yes.
All right, wonderful. And I just didn't want you to feel alone in having a technology glitch today. So
I don't know what the problem is.
Yeah, I'm just technology challenged. I'll just go with that. Kim Taylor, the staff person who you all were introduced to last month, who supported the self-advocates in their presentation. She helped 3 more self-advocates submit a proposal to present at the ARC of Illinois annual convention in April, and their proposal was accepted. So they're pretty pumped. And anyway, look forward to sharing more information with you about that as we get closer.
Thank you. That's awesome.
That's great.
Lynn, is there anybody else with their hand up?
No, there's not. Not that I can tell.
Okay.
I can't.
All right. Well, we can always come back if people think of something later. Let's go on to item number 12. And the first thing is an update on the mini grant project, which was beautifully presented, pages 13 to 16. And I wrote in my notes next to it that this was a bright spot in the presentation. So thank you very much, Kim Bowdry. And Kim, do you want to talk about it?
Well, I'm going to say that we are almost done. As Lynn mentioned, the one Menards purchased has that was a vanity for a person who was making an accessible bathroom for their daughter. And unfortunately, that vanity shipment has been further delayed. I do think that and 2 bed frames for 2 brothers are the last items to be delivered. And the bed frames should be delivered anytime. So it was a long and at times grueling process. I do often forget about how grueling it was when the families, send an email, or when I read the survey results about how, wonderful the items were and how much they helped. So it was grueling, but it's easy to forget about all that time and effort put into it when you hear how much this has helped people.
Well, I want to make just one brief comment about this because I was involved in this process from the very beginning, and I volunteered to be on the committee to review the applications and make the selections. And I must admit that I was a mini grant skeptic, and that's one of the reasons that I volunteered to be on the committee, because I wanted to see, what the process really was like. I'm still a little skeptical about the process, but I must say that it has worked out much, much, much better than I had anticipated. And I think that's due to a tremendous amount of work on the part of our staff, But the thing that was most inspiring to me was that these were requests that came from individuals coming from their own life experience and their own needs and identifying things that would make a difference to them. Some of them I was a little, okay, what? When I reviewed the applications, but a lot of them that I was skeptical about have turned out to be very, very helpful for people. And the comments for people and their evaluations saying how useful the items or the services were to them have been very positive. So I think on the whole, it's been a very positive experience. Whether we want to engage in this very time-consuming and labor-intensive activity again or not, I don't know, but it has been a very positive experience. And a lot of that is thanks to the tremendous behind-the-scenes work by our staff. So thank you very much. Anybody else have anything to say about the mini grant project?
This is Kim. I'll just echo, Anne, what you said about the narratives or the quotes, the comments from recipients. It was really helpful as somebody newer to the process to understand, how they would be, how some of this, some of these purchases were helpful to them. And thank you for putting together the report, Kim.
Okay, so we move on to item B, funded agency programs 17 through 27. And this is really information and a tier sheet and chart. And I just want to say thank you for putting together this interesting format. And also I really appreciated having the mental health board programs just for information. So I will hold on to this and keep track of it. And thank you very much for it. Any other comments about the funded agency programs?
I just would reiterate what you said. It was very helpful to have this all in this format. And it is something to hang on to and refer to. I had a question about one of the programs that was terminated. There were a couple terminated, and I knew mostly why they were terminated, but there was one on the very first page, on page 17, Rosecrans Central Illinois Coordination of Services, and it was terminated in September. Does anybody know why? Well, I'm sure somebody knows why. Can you tell why?
Kim Bowdry, are you comfortable taking that one?
Yeah, I can share. They had a very difficult time maintaining staff for that position. It is a pretty unique position in the requirements that it be a person that can be certified as a qualified intellectual disability professional and also has the qualifications to become a mental health professional as well. And I think the staff shortages, played into that as well. And so they decided that they did not want to maintain the grant, but they were going to continue to serve the people that were enrolled in that program and also new people that they received referral from, just do it with other funding.
So staffing problems again.
Yeah, seems to be the main issue.
Yep.
Okay, thank you for that. Any other comments?
I just want to say thank you for having putting this all together. It's just like really helpful. It was super helpful for me, kind of trying to still learn all the different programs that agencies are doing. So having it all in this one place and in this table format, it was just really helpful. So thank you, whomever did this, or the staff who did this, I guess.
This is a team effort, and the first time we did it, Kim Bowdry put it together for us, so we just kind of update. I want to show you something else that's available to all the public. What's nice about that document is that we can easily send it to people who are asking, what do you do with these funds? And there are a lot of people who are interested in that. So there's something else that we offer, and I don't know if people have seen this, but this is the homepage for that site where agencies register and apply, and then if they are funded, they report, you know, do these quarterly reports and then some annual reports too. So the very first line, here is information on programs currently funded by the boards. We've created this page where it's not just the summaries that you've seen in that Excel document, but is the whole, this is what the agencies in their own words have described as the scope of services in their application. So you've got which board funds it, what the agency is, the program name, the full description of scope of services, and a link to their website. Uh-oh.
Oh.
Maybe. So anyway, that is I don't even know if I can get out of there, but that's like, the idea of that was just to make it available to anyone. They wouldn't have to ask us. They could just go find it. But I don't know if people can find it. So, and it, you know, it's a lot more detail. So to pack it up and send it as an, you know, as an electronic document through email might be a little bit more cumbersome than the other one. So we're keeping the other one around, and I still, you know, I thank Kim Bowdry so much for getting that started and making it like an actually usable document. So.
Lynn, thank you so much for sharing that. I feel like I've seen this before, so maybe in my orientation you shared this. Maybe on the website, it would be helpful if it had like a heading. So like if somebody, you know, it's big and bold, you know, somebody can see, you know, currently funded projects, and then under that is just the sentence that you have there, here is the information. And then under that is like another heading, general information. So that maybe just kind of, that might help if somebody goes to the website to see it. Yeah.
It's kind of, it's hard for me because I think all of it is important. Like it's hard to, you know, add headers to everything that I think is important, because then it's all going to be bold. So thank you for the input. Like what is actually important? This is also maybe an underutilized library of, down here are a whole bunch of downloadable documents. They're mostly Word, sometimes PDF, with like board bylaws and the 3-year plans and the current funding array and the new priorities and the community needs assessment and application instructions, even in Spanish. So there's a lot going on this public page. Maybe I need some help to design it in a way that it's actually more user-friendly. So.
Well, you have enough to do. You don't need to also be web design as part of, you know, but I appreciate having you sharing that information.
All right, thank you very much for that. Lynn, are we going to do a SILA update, or are we deferring that because there's very little change?
It's such a small thing. Hopefully I'll have, you know, more in February. Yeah.
Okay. All right. Okay. Schedules, anything to be said about schedules? Acronyms and glossary are for information. CCMHB input.
So they're meeting this evening and they have a similar schedule, but the Mental Health Board has a tradition of whenever there are new programs, then they do like a little 6-month progress report on how things are going. It's kind of hard to get a whole program started in 6 months. So a lot of times we're still talking about the concept, but they have 6 new or expanded programs to hear from in the next, you know, across the next 4 meetings. So we start tonight, it'll be a presentation on the Dream House, which has an expanded program there. So otherwise their business is roughly similar to yours tonight. There were several agencies funded by the Mental Health Board who were having problems getting the audit delivered on time and could prove that it wasn't their fault. So this was it was that concern which triggered the action. And then we heard from a DD board funded agency, but they've resolved the problem as of yesterday. So, you know, I'm sure that'll be a discussion item tonight. and an action item too, because it's, I think maybe 6 organizations are still waiting. I do want to just say that it's been good that we can do these meetings remotely. I know there are some technical problems. Someone mentioned that it's hard to get to the Zoom meeting from the agenda here, but we actually send out an email with the link, and it's always the same link. So if you get it once, you can put it in your calendar, hopefully to be able to get in. But once we're all perfect at doing it, the remote meeting might just go away. So we can always have hope. I don't know what to expect for February. Maybe Dr. Robin, maybe you have an idea of whether our meeting in February should be remote or.
Well, I really don't know, but I think probably we should anticipate that it will be remote.
Okay. So more to come on that. And it's mental health board is in the same place. It's, you know, a lot more people. And then typically the audience is larger too. So when they go back to in person, it's going to be a lot more exposure. This room is pretty big, but it's probably not, I don't know, probably not big enough for that crowd. We'll see.
Okay, thank you very much for that. Staff reports, again, were excellent. Any comments about staff reports or any questions? And again, thank you to all staff for your continued good work and your reports. Are there any board announcements?
Well, I had a question. This was before you got on, and I had asked Lynn if I could bring it up. So this has to do with the ARPA funds. So I was watching the Urbana City Council meeting last night, and the mayor had said that in January, like January 6th, the final ruling about the ARPA funds and how it could be spent was finalized at the U.S. Department of Treasury, and that they had expanded kind of their definitions of what the money could be spent on. And so I went and looked, and there is in the final rule a item around premium pay and how you can broaden using that money. You can use that money for premium pay for frontline workers and people, essential workers, and people who are, particularly with the focus on those who are lower income. And so I just, you know, it made me think about the conversation we've had about premium pay and how, you know, DSP workers not getting just turnover, etc. So I don't know if we've missed the boat on, you know, advocating to the county board with both the DD board and the mental health board about, you know, utilizing some of that funding for pass through to agencies for premium pay. But, you know, maybe we missed the boat. I don't know. But I just wanted to bring it up to see if anybody had thoughts about that.
I did make a request. I had, by the time ARPA was passed, I had attended probably 5 webinars on it, and also had been advocating for its passage through our national association for several months. So I was ready with some proposals and ideas. I'll put them in the chat. The first document that I sent to the county board was before that. I mean, it took them a long time to put a process together. So let me see if I can get these into the chat effectively. But I used a very low estimate for premium pay. It had not been described yet in the interim final rule. I don't know if the final rule expands it, but my estimate was very low, and it was based on the difference between the state's rates recommendations and what the state was doing, and it's about $3,100 a year. So yeah, I'm gonna have to go fishing for these documents, but it was a very low estimate for premium pay. The county took up county then asked for individual ideas to be presented in like a very, brief format. So I produced that too. And so that's my second memo. I think, okay, so here's the first one. I'm putting that in the chat. For some reason, there's an error coming up. Well, at any rate, that was my ask, was that for all of the direct support professionals working within Champaign County, that a premium pay of $3,100 something be offered. And then my second ask was the same, but this kind of got lost. And then the county is right now doing premium pay for its own staff, but only certain staff. There are criteria for it. It has to be people who showed up in person during certain months. So then I was looking at the state of Illinois had the opportunity to use their ARPA funds to do premium pay for direct support professionals. And I, looked at their ARPA plan, and it's just all in one line. So I can't tell if they're doing premium pay for DSPs. So I wouldn't say we've missed the boat. The county has until 2023 to authorize uses for the funding. And they have established more of an assessment and public discussion process, but they've also had requests that exceed their $41 million allocation by it's like 3 times the allocation. So they're, they did a little bit of money for mental health programs, but they said, we're only gonna do this for 1 year. And that was programs, not what you're talking about. That premium pay really does seem like a great place to start with our DSP problem. So I could bring it up again. It got lost in the shuffle when they started to consider all the requests that they had received, maybe because I was so early in the process. And I'm sorry I have been unable to put these memos into your chat. It was real important to me because, and I should look at the final rule to see if it's, really like even better circumstances. So.
Yeah, I don't know how the interim is different than this final rule. And again, it just, it triggered in my mind, just listening to the meeting last night and, we're searching for it. So yeah, I guess I just don't know. And, the other issue is not just you sending a memo, but like going to a county board meeting and in public, me as a public citizen saying like, hey, remember this. I don't know, not that would be helpful, but I don't know. It was something I was thinking about.
I think they're always having meetings about what to do with that money. So I do think that's a great idea, like showing up and representing. They had, at the time when I presented these requests, there was actually a DSP on the county board. That person has moved away. And they, personally thanked me for thinking of DSPs, but so now what do we do, right? Like it is again, like not a very well understood job. And I think that's the core issue. So to demand, respect for it and to demand more money for it based on a foundation of like, they're invisible. I mean, I think showing up to county board meeting to talk about it is a fantastic idea. So, I'm not keeping up with their agendas very well because they have so many meetings, but.
Well, this is helpful. Thanks, Lynn.
And I was able to put both memos into the chat.
Okay, this is Ann. Thank you very much for that. That's a very good idea. And let's not drop that idea and let's carry it forward.
Sounds good. They have a meeting tomorrow night. I just checked. So maybe I'll try and see if I can go. Yes, that would be helpful. Sorry, Anne, in the chat, Patty mentioned, Walters from DSC, I think, right, Patty? Mentioned could providers provide letters about this issue to board members. Actually, that might be helpful. Would that make it more, I think having those letters and speaking, that probably would be even more powerful.
And it could be that, you know, they're in a moment right now where they've already allocated everything for this year. And, you know, so I think that's a good time to start talking about like what could happen next. I think that's a time when, you know, if they're not scheduling study sessions on the topic, they might, you know, it might get their attention like, oh, there's this whole other thing we could do with ARPA funding that we haven't talked about at all. It's worth a try. And I appreciate y'all, you know, thinking of this. I think memos from me, you know, sometimes get put on a shelf because there's a lot of them. So.
Well, thank you for that. Any other comments? Any more discussion, or should we adjourn this meeting? Say something. I can't see you.
Oh, sorry. I have a motion to adjourn. I don't know.
Yeah, I don't know. I just want to know if people are in agreement with adjourning.
I think you're on to something.
Adjourning
All
sounds,
right.
sounds
Okay.
fine.
Well, thank you so much for this meeting, and thank you for your participation. And I will try to see if I can figure out how to get onto Zoom next time. Thank you very much.
Thank you, everybody.
Thank you.
Bye-bye.
Okay. Bye-bye.